Just imagine we could understand what's wrong with our bodies by actually looking inside them.
Wow, that is something. That's amazing.
This series is all about helping families who, just like mine, are trying to get to grips with health challenges.
It's always there in the back of your mind.
It takes away your happiness.
I just want to know the truth about what's happening in my body.
By bringing people together with state-of-the-art technology, let's flip the visors down on our headsets. We'll let them literally see beneath their own skin.
So let's peel away the bones.
Wow, look at that.
Gosh, I have never seen anything like this.
Is that my prostate? It's like a big haggis.
It's just really incredible to see inside me.
Working with the country's top doctors, they'll have a medical consultation that will truly astonish.
So you can see the healthy uterus here, and this is yours.
Just to say, these are your breasts. Helping them to not only understand their condition.
That is what's causing your pain.
Oh, really? Oh, truly, that looks startlingly different, doesn't it? But also make the key treatment decisions they need to get better.
What we'll be doing is removing all of the left lobe.
You can see it's shrunk right down to almost nothing.
Now I can see it for what it is, and I want to get it removed, and I want to be better.
Oh, bless you. I'll be there for every step.
How was my brain?
As we use the power of technology.
You are incredible.
To bring hope to our lives.
Knife, please. I will never see life in the same way again.
So thankful for the care that you and your medical team, without you, I wouldn't be here today.
This is your health as you've never seen it before.
Quite handsome, isn't he?
If you're the one that's got a health problem, you tackle it head on and you deal with it in your way. But sometimes the loved ones are worried sick for you, feel helpless, but want to do everything. So I think this is going to be incredibly useful for people who are caring or supporting somebody who is unwell. It just means that they can understand more the impact of whatever the condition is. We're bringing patients and their doctors together in our unique imaging centres, where they'll have a mind-blowing consultation that helps them get to grips with their condition from the inside out. With the help of consultant Dr. Goody Singh.
So let's have a look at the scan, shall we?
They'll get the ultimate insight into what's really going on inside their body.
With the latest technology and augmented reality, we're going to show you your body in a way that you've never seen it before.
Today, 44-year-old Paul and his wife Lynn will be the first pair to visit our state-of-the-art imaging centre.
Get your pizzas, girls. How was your day?
Paul and Lynn currently live in Peterborough with daughters Molly and Amy. Up until 2 years ago, Paul was working 50 hours a week in his job as a flood risk manager.
At work, I used to pride myself on my ability to quickly absorb data and information.
He was also something of an action man with a love of competitive swimming.
So this is the Great East Swim, and it's in the dunes. So this is, I think, must be the last event I've did.
I think you were just proud the whole day.
But one morning in November 2019, Paul's active life was abruptly put on hold.
Nothing unusual happened the night before. We just, just a normal night. And then the alarm went off, and the alarm kept going off. And then he fell out of bed. I was like, what are you doing? Stop mucking around. He's lying on the floor, but trying to move, but not getting up. I don't know, like a fish out of water, kind of wriggling, but not doing anything. Do you remember trying to move and not being able to?
Yeah, I couldn't move, so I was literally petrified, but there was no pain, so it didn't feel... It just felt really, really bizarre, like an out-of-body experience.
Paul was rushed to hospital in an ambulance where doctors confirmed the worst.
You don't think you're ever going to have a stroke in the 40s, do you? But I'm pretty sure I did realise it was a stroke, even though I'm not a student of, well, certainly wasn't beforehand, of what a stroke is.
With no obvious risk factors, Paul is bewildered by what happened to his brain on the day of the stroke and unclear exactly what doctors did to save him. 2 years on, he's desperate for answers as he tries to put his life back together.
Understanding what happened might give me some form of... Closure's the wrong word, but it'll give me some form of informed understanding, I think, that then I can go, right, OK, I understand, hopefully better, what impacts the stroke has had and why, which bits of the brain were damaged, when and why. I'm kind of intrigued and fearful, if you like, to understand the what-ifs within all of that.
A stroke occurs when the blood supply to part of the brain is cut off, starving it of oxygen. Strokes are most commonly caused by a blood clot blocking an artery that feeds the brain, but can also be due to a burst blood vessel or bleeding on the surface of the brain.
So here we are. Take a pew, you two.
Paul is about to get the chance to peer inside his own brain and see what happened as his stroke hit.
How does it feel now you're here?
A bit nervous, got to admit, but really excited.
I'm intrigued.
Hello. Hello. How lovely to meet you. Are you ready to come through?
Will do, yeah.
Come with me.
Dr. Goody will be joined in the consultation by neuroradiologist Dr. Yogesh Joshi, whose emergency team treated Paul when he arrived at hospital.
You're looking very well.
I'm feeling good.
To explain exactly what happened, we'll be travelling back to the night of the stroke 2 years ago.
So, Paul, the last time you saw each other, you probably don't remember much of what happened.
Yes, I remember the before. I remember some of the during, but the after, certainly the hour or so after the procedure, is a bit of a blur to me, yeah, absolutely.
That's not unusual.
OK.
A lot of things going on, lot of things going on with your brain at the time.
Yeah, and this is going to be intriguing.
Are you feeling ready to do this, then?
Yeah, absolutely.
OK, come with me.
OK.
Emergency scans were taken when Paul arrived at the hospital, which we've turned into incredible 3D augmented reality to explain not only where the stroke occurred, but the incredible procedure that was carried out to save Paul's life.
OK, so we're about to see inside your head, Paul.
From a room next door, Lynn and I will be watching on.
We will be able to see what Paul is seeing. Yep. And see his brain. Yeah.
Should we put our headsets on?
Wow.
You might recognise this one.
I'm even more bored than I normally am. Wow.
I didn't want to say that.
Come and have a look. Come on.
Yeah.
Meet yourself.
I know. I've never seen the back of my head before.
Yeah.
It is, yeah, no, that is truly bizarre. Wow.
What I would love to show you is what it looks like inside. So if we peel away your skin, next.
Virgin.
Yeah, well, OK.
So this is your skull. So these are the bones that protect everything that's inside.
Quite handsome, isn't he?
But it's what's inside Paul's skull that holds the key to what happened during and after his stroke.
So let's peel away the bones.
OK. Ooh. Wow.
Welcome to your brain.
OK.
Wow, look at that.
And you can see all around it.
That's not just a diagram, is it? That's him.
Right. Ooh. Now, this is the network of vessels that feeds your brain with blood. Now, your brain is an incredible organ and it needs as much blood as it can get. Yogesh, can you just describe the path that the blood has to take to be able to get to the brain?
Yeah, sure, yeah. So this big artery here, that's the aorta. And all the blood, the oxygenated blood, is coming out from the heart into this vessel, eventually becoming 4 vessels, which all go and meet at the base of the skull here. That's really the central point where all the blood can go and then go to the rest of your brain.
You've got a better view of it here, actually, and you can see all the vessels going up into the base of the brain.
Yeah, wow.
These arteries are huge. These are the ones that you feel on the side of your neck, and that's the blood pumping up to your brain.
To function properly, every minute our brains need a litre of blood containing oxygen and nutrients, which is pumped up through 4 arteries and fed to different sections of the brain. Dr. Joshi was able to image the blood flow inside Paul's brain soon after arriving at hospital, leading quickly to a diagnosis.
We've actually cropped away the smaller vessels. So you can see that this artery comes over here and then it divides into various branches. On this side, you can see that it just stops abruptly.
Absolutely.
And if it stops like that, we know that there must be a blockage.
A huge network of blood vessels supply the brain. Here we're only focusing on the key ones that were imaged at the time. Blood should flow equally to both sides of the brain, but in Paul's case, the left side was showing an area with no blood flow at all.
You can see that white dot.
Yep.
And that's essentially where the vessel was ending.
Right.
So we can't see actually the vessel beyond it because it's not filling.
So that's my clot?
That's your clot.
Wow.
Paul had suffered from a common form of stroke where a blood clot had blocked a key vessel feeding one side of his brain. Clots can often form elsewhere in the body, break away, and are pumped upwards towards the brain, getting stuck when the vessels become too narrow.
How big was the clot, dare I ask?
It was about 1 centimetre, extending from there.
Yeah, OK. That brings it home. Ooh.
So you're face to face with the thing that caused all those symptoms.
Yeah, little swine.
When Paul's stroke first hit, he began to experience a combination of strange and unpleasant symptoms.
You didn't know what was going on, really. So, and it was clear that then you couldn't move your right-hand side. You're just like sprawled on the floor, so like willing his hand to move. And then you started to look worried. You weren't speaking properly.
Because in my head, I was like, well, you know, what do you normally do to get your arms and legs to move?
Yeah.
You don't normally think it, do you? They just sort of happen.
It was just before the school run, so Paul's daughters, Molly and Amy, were still at home.
I saw you lying on the floor. You looked a bit paralysed.
I was a bit paralysed. Do you remember much, James? Do you remember holding my hand on our bed?
Yeah.
I needed that.
And then you sort of said something, but it didn't make sense. And so I was like, I know you think you know what you're saying, but what you are saying is not proper words. It's not what you think you're saying.
In our imaging centre, the doctors want to delve deeper to explain exactly why Paul struggled with movement and with speech.
Why was the clot there impacting my right-hand side? So why was I paralysed on the right?
OK, so again, when you look at you from the front here, that is your left side of your brain.
OK, so I'll be like this?
Exactly, exactly. And so the left side of your brain controls the right side of your body.
OK.
Yeah, and that's the way that we are wired up. Now, there's a few important areas that we've highlighted here.
Yeah.
The yellow is what's called your motor cortex.
OK.
And that controls all of your bodily movements.
So that bit would have been affected when I was trying to move my hand when I fell out of bed, and I couldn't.
You couldn't move.
But I was trying to think my body to do it, and nothing was happening.
And because there's no blood supply getting to that part of the brain.
Yeah, OK.
During his stroke, Paul also had trouble with his speech.
Now, you see those pink and blue areas?
Yes, yeah.
Yeah, those are to do with language.
Right, okay.
And normally, language lies on the left side of your brain.
Yeah.
And so whenever we see someone with a left-sided stroke, we worry a lot more that their language is going to be affected. You're trying to think of words, you're trying to articulate the words, you're trying to say the words, but you can't say them because these areas are not getting enough blood.
Okay.
Because the left side of our brain is responsible for most of our language skills, a left-sided stroke can often affect speech, as it did in Paul's case.
If we hadn't have done anything, how much worse would that have got?
We know that once an artery is blocked, the figure we use is that you lose 1.9 million neurons every minute.
That's quite dramatic, isn't it?
The longer the delay in treating a stroke, the higher the risk of long-term neurological damage. Lynn's quick thinking to call an ambulance and get him treated was vital for Paul.
Looking back and seeing the what if you hadn't done anything kind of reassures you that whatever the risk at the time...
Oh, totally worth it.
It was the way forward, wasn't it?
Yeah, absolutely.
Around 20% of Paul's brain was starved of oxygen for 6 hours. Key questions remain, including how a state-of-the-art surgical procedure that began in his groin ended up saving his life.
I felt something go up past my ear.
When, like Paul, you're recovering from a traumatic event like a stroke and faced with uncertain outcomes, it can be tempting to turn to alternative medicines like CBD. We assume they will provide physical and emotional relief, but do they actually work? Here's Dr. Karan to tell us more.
So, CBD supplements, they seem to be everywhere. So are they a scientific miracle or just a scam? CBD has a lot of potential, especially with treating a wide range of conditions from arthritis to depression. And it's also massively under-investigated. But thankfully, right now, there are loads of clinical research and trials going on specifically on CBD. CBD has potentially a wide range of benefits that we're learning more about every single day. Now, you might be thinking, why is a doctor talking about CBD? And when I talk about CBD, cannabidiol, I definitely don't mean the stuff that you get when you smoke marijuana. That has CBD as well as THC, the stuff that can get you high. CBD specifically doesn't get you high. CBD, or cannabidiol, works on the body by mimicking or boosting the body's natural endocannabinoids. And our endocannabinoid system has a huge role to play in pretty much everything. Pain, sleep, mood, appetite, everything. Right now, there's not a lot of scientific data or research to back up the claims that it can do all of these things that the endocannabinoid system can do. And even if it did help with sleep and mood and all these other things, we still need to figure out the right dose and delivery method. On the whole, CBD is relatively safe, but as a drug, it does have side effects. And the most significant side effect is its impact on the liver and how the liver metabolizes other drugs that people take on a regular basis. CBD can actually increase or decrease the blood levels of regular medication that people take and therefore increase its side effects. And here's the advice I would give friends and family. If you're thinking about taking CBD, or even if you're taking it right now, research it very well and speak to your doctor so they can monitor you for side effects and its interaction with other drugs that you might be taking.
Staying on top of our general health and well-being is crucial, but more serious symptoms should always be checked out by a medical professional. 70-year-old Janet has come to one of our imaging centres with husband of nearly 50 years, Tom, to understand more about her recent diagnosis and treatment options.
Take a seat.
Thank you.
Thanks very much.
How are you feeling today?
Ooh, a bit nervous.
Lovely to meet both of you.
Thank you.
Nice to meet you.
You're facing a tough time at the moment, aren't you?
Yeah, but I'll get through it.
You'll get through it with a positive attitude. So tell me a little bit then, what was the first time you thought something might be up?
I started feeling very uncomfortable under my right-hand side, under the ribs, and going through to the back as well, a backache. And then I started getting severe diarrhea, then constipation, And then back to severe diarrhoea. I thought, and very, very uncomfortable. And I thought, there's something not right here.
Janet and Tom live in Essex.
2 pieces together there. That's cheating, though, isn't it? Tom and I met, I was about 18, I suppose. We sort of knew that we were meant to be together. And then 2 weeks after we first met, he asked me to marry him. So I thought, yeah.
She'll put herself out to help anybody. She is really, well, perfect.
But in the last 2 months, Janet's worrying symptoms have meant she's had to seek out medical help. An examination of her bowel has revealed a potentially life-threatening diagnosis.
Got the appointment for the colonoscopy and saw everything that was going on. And I heard the consultant say, oh, that's cancer. And I actually saw it on the screen.
Colon cancer is the 4th most common cancer in the UK, with 43,000 people diagnosed every year. Most colon cancers develop from pre-cancerous growths called polyps, but not all polyps become cancerous. Key symptoms are persistent blood in stools, persistent change in bowel habit, and persistent lower abdominal pain.
I wasn't anxious at all.
But Tom, you were for her.
Yes. And then the surgeon came along and said, then shut the door and sat down, and then he came out with a word. You know, it looks like there's cancer. And she's got to go for a scan to check that it hasn't spread.
He was devastated.
Still hard now.
Still is. You silly man. You're a silly man. I'm fine.
I know.
I'm fine, and I'll be fine.
I know.
Bless him.
Tough, though.
Yes.
Tough.
Yeah.
But nevertheless, today, you're going to come face to face with your own body and the cancer that's there at the moment.
The nasty little beast. Got a name, Beastie.
Is that what you call it?
It's a beast, yeah.
So, have you thought about what that will feel like?
I think it's going to be quite exciting, actually. I mean, none of us know what the insides of ourselves are like, but I think it'd be really quite interesting, you know, see what what's going on, sort of thing.
Walking Janet through her virtual body is colorectal consultant surgeon Dr. Subhash Vasudevan.
Hello, everyone.
Here he is now.
He's here to show Janet the tumour in her bowel and to help her understand what the best course of treatment will be to prevent the cancer spreading.
Grab a headset, please.
Thank you.
Using her medical scans, we can show Janet her own pelvis and neighbouring organs in 3D.
So, Dr. Subhash, take us inside Janet's body.
Do you want to have a look, Janet?
Yes.
Yes. Let's have a look.
Shall we pop them on?
Absolutely.
OK. Pop these on our head, and then we'll be able to see what we can see. So this is your intestines, Janet.
Wow.
Do you want to come round and have a look?
Yeah.
Have a closer look.
Oh, my word. There's quite a bit there.
It's hard to know what to make of it all, isn't it?
Yeah.
You can see quite a lot in there.
Yeah.
And it's obviously the other organs have been removed to see the main areas of interest,
Right.
as you can see.
Wow, that is amazing.
For Janet to understand what it is that's causing her problems, first Mr. Vasudevan wants to show her the intestine in greater detail.
This is a bigger picture of what we saw earlier. You can see the stomach there right at the top.
All right,
so
yeah.
the food pipes joins there. So the stomach is the first bit where the food gets starting to get digested. So food gets collected, gets churned up with acid and certain digestive juices, and it stays in the stomach for about 2 to 3 hours before it can get into the small intestine, which just starts here. And then the small intestine is the workhorse of digestion.
The 3 to 5 metre small intestine, or small bowel as it's also called, uses enzymes from the liver and pancreas to break down food delivered by the stomach. It then churns the food into a liquid before absorbing the nutrients and most of the water that the body needs.
It's an extraordinary thing, isn't it, to know that this is going on inside your body?
That is, isn't it?
Yeah.
Look like some oversized sausages, doesn't it?
Well, it does. It does. You're absolutely right. And you can come round here. That's your bottom.
Me bum, yeah.
There it is.
Yeah.
Once the liquidized food makes it through the small intestine, any remnants are passed into the large bowel, also known as the colon. Here, any remaining water is absorbed and stools are formed.
So we're looking at the colon, the entire colon along with the rectum and the anal canal here.
So the rectum, or bottom, is right down here,
right
Janet.
down here.
There you go.
Wow, big, isn't it?
It's all to scale. It's all appropriate.
So Janet, I'm going to take you on a journey around your colon.
Okay.
So you can see here, this is the beginning of the colon where the appendix is. And as the stool passes through, and as it gets further down, it gets more and more water absorbed. And as we start entering more down into the left side, the stool is getting firmer and firmer as you come down. You can see already that the muscle contracts like a snake, like a hollow snake, pretty much expelling what's in there, taking it from A to B.
I don't think that's a bit of cake in there.
And then eventually it reaches the rectum, which is here in the pelvis, and that is where the stool is stored.
Yeah.
And when the time is right, you empty the bowel.
Yeah. So interesting, isn't it?
Isn't it fascinating? It's like a sort of huge serpent, doesn't it, snaking about? So, what are your thoughts, Janet, on coming face to face with your insides?
It's quite amazing. I never expected it to look as detailed as that.
It's extraordinary, isn't it? You can actually go in and move through your own internal system.
Yeah.
Fascinating though it is to see the colon like this, there is an area which we need to get stuck into, isn't there, Dr. Subhash? Where is the area that's causing the problems for Janet?
So, Janet, you can see the whole colon laid out here. The area of interest we're looking at is this bit, which is the first bit of the large intestine on the right side.
So is that where the tumour, the cancerous tumour that Janet calls the beast, is located?
Yes. So your tumour is located in this area.
Right, okay.
If you come over here, Janet, you can see that is the tumour.
So this is the beastie.
Doesn't need a ribbon on it, does it?
You can see the tumour quite irregular. It's not got a specific shape. And your tumour is around 4 centimetres in size.
Yeah.
At 4 centimetres, Janet's tumour is large enough to get in the way of food and fluid coming from the small intestine, causing constipation and discomfort.
Strange to look at it in that way and know that's inside you.
Yeah, it's nasty looking. I feel dirty. I know it's ridiculous, but I feel dirty, you know. Something's nasty inside and... because I'm such a clean person anyway, and I just, I think it's horrible. I'm not, as I said, I'm not in any pain through that at all, not at all.
But you want to get it out?
I want it out, yeah.
Shall we get Tom in? Because you might have been staying positive, but I know that Tom has been very worried.
He has, bless him, yeah.
Shall we get him in and chat
yeah,
to him?
Yeah.
Tom, do you want to come in?
Okay, yes.
When I was told I got cancer, I didn't worry at all. I just know if I didn't feel like that, I'd be a blubbering wreck, I think. But I'm not that type of person.
You okay?
Yeah. But Tom has really taken the news very hard. He's broken down a couple of times and apologised. I said, you don't need to apologise. It's best to get it out in the open, you know, it's fine. You're here for me, you're looking after me. It's not a problem.
It's emotional for you, isn't it, Tom?
Definitely.
Would you like to have a look for yourself?
That would be brilliant, yeah. We've been together so long, and we've got another 10 or 20 years ahead of us, hopefully. It's heartbreaking, you know, to get that sort of news. Yeah, I admit I have broken down, but I think I'm getting stronger now. I still well up when people talk to me about it. Like now, when you're talking about it, you can probably see I'm welling up now. But her being so strong has definitely helped me.
Right, Tom, if you flip it down, if you look here, this is Janet's bowel.
Oh, wonderful. That is absolutely amazing.
So this is the area that's been causing Janet all the problems.
Tom, can you see now where the tumour is sitting, yeah?
Yes. But that is the actual tumour itself, is it?
Yes.
That's amazing.
But you'd like to give it a punch on the nose.
Yes. Good.
Yeah, you just got to grab it
That's
and
right.
take it away.
Yeah.
Which is what you're going to do.
Yeah,
which
we're
is
doing it a bit
wonderful.
more with a lot more finesse.
Yes.
Quite right,
Yeah.
quite right.
The worst part is you cannot do anything about it. You've got to rely on other people now to sort that out.
Well, hopefully coming face to face with the problem has made you ready for the next stage.
Definitely, yeah.
Thank you, Tom. I'm glad you've had the chance to look at it. We're going to continue with the consultation now. I'll take you back outside to relax with a cup of tea.
It just knocks you for six, what did me anyway. I want to know there's a cure, and to know once it's gone, she'll be back to normal again.
Right, now, headsets back on, Janet.
Okay.
With Tom settled in next door, it's time for Mr. Vasudevan to walk Janet through her treatment options.
So how do we get the beast out?
So, for colon cancers, the mainstay of treatment is in the form of an operation. So you can see this is the colon opened up there, and the tumour sitting inside, and you can see the small intestine joining there as well.
Yeah.
So what we have to do is we have to remove the tumour along with a foot of the large intestine.
Wow, a foot?
Quite a bit then.
Yes.
Because cancerous cells can spread to nearby lymph glands, Mr. Vasudevan needs to remove not just the tumour, but also some of the tissue around it. To do this, he will cut out 1/5 of Janet's intestine. Fortunately, the large intestine is around 5 foot long, so Mr. Vasudevan will have plenty of healthy tissue to make a join, which he'll fasten with surgical staples. Finally, tissue from the tumour will be sent for a biopsy to see whether the cancer is aggressive or if it has spread to lymph glands, in which case Janet would need chemotherapy.
So for the tumour that you've got here, it's very, very unlikely I'll have to give you a stoma bag or anything. I should be able to join you back together.
Wonderful.
I'm sure it's a big relief for you as well.
In a way, yeah.
Yes.
Are you surprised at how much they take away?
Yes, yeah.
But you still have a lot of colon left.
Yeah.
And generally the remaining colon will adapt itself to be able to absorb all the water, and you shouldn't see any major problems with long-term with your
So will I have to adapt my diet, say, I've got a very sweet tooth.
Initially, you might have to modify a bit, but with time, the body will adapt and you might be able to get back to a more normal routine of diet.
Okay. So I could lose a little bit of weight then, couldn't I?
I love the way you think of the positive.
I've got to.
Got to think of the positive. How has it been seeing inside yourself today? Do you feel
Fascinating.
more ready?
Well, it's put my mind at ease if I did have any doubts. I certainly haven't got any doubts now as to what's going to happen.
Well, good luck with the operation. You're in very safe hands.
I am.
Good luck.
Thank you very much. Thank you.
In the past few years, evidence has been mounting up about the link between consuming red or processed meat and an increased risk of colon cancer. Although genetic factors play a big part, we can all reduce the risk by lowering our intake of red meat. Here's Dr. Karan to explain the limits and tell us more about the harmful chemicals in red meat.
There are some chemicals which are naturally found in red meat which can actually increase the risk of cancer by damaging our cells. For example, nitrates and nitrites. These are chemicals used to keep processed meats fresher for longer. And when we eat them and break them down, these nitrites can be converted into chemicals that can potentially increase the risk of cancer as well. And also heterocyclic and polycyclic amines can increase the risk of colon cancer. These chemicals are produced when red meat is cooked at very high temperatures, grilling, barbecuing, and what these chemicals do is it may discourage the growth of good populations of bacteria, which could disrupt the microbiome, and the disruption in the microbiome may be linked to an increased cancer risk. Now, red meat can be part of a normal balanced diet, but eating too much of it, that can be problematic. If you're eating 90 grams or more a day, that's probably a bit too much, and the NHS recommends that you cut down to 70 grams or less a day. So what can you actually do to lower your colon cancer risk? For one, you can cut down on red meat. Exercise is always good. Exercise has been linked to reduce cancer risk across all cancers. And to add to that, I'd probably say one more thing which can definitely reduce your risk of colon cancer: eating more fiber. Just by increasing your fiber by 10 grams a day, research has shown you can cut down your bowel cancer risk by 10%.
Small changes to our lifestyles can go a long way to improving our overall health. But sometimes we develop serious conditions that only cutting-edge medical science can resolve.
Yeah, and that's essentially where the vessel was ending.
Right.
2 years ago, 44-year-old Paul suffered a life-changing stroke.
So that's my clot?
That's your clot.
Wow.
Having seen how the stroke affected his brain at the time, Paul now wants to understand exactly how it was treated as he arrived at the hospital as a medical emergency.
All I remember is the ambulance doors opening in this sort of, I guess, A&E bay there, and you're sort of straight into a whole set of people, all in white gowns, and thinking, and then time sort of goes a bit blurry. Yeah, then the last I can remember is being in this massive waiting room. I was the only person in there with my stroke consultant, and this is where he described, "Paul, you've got brain damage." I was like, OK, that's some words I do understand.
With a blood clot firmly lodged in a vessel feeding the left side of Paul's brain, parts of it were being starved of oxygen. With time of the essence, the doctors offered him a revolutionary treatment called a thrombectomy to eradicate the clot.
And they were like, "Right, can we take you into it now?" And I was like, "Well, can I wait for my wife to turn up, please? Because I don't know that I'm going to survive." It's like, it was all of this. So that's when I called you. So that's when I called you, when you were literally in ambulance.
I was like, I'm in the entrance, just trying to get through reception.
So yeah, so you came in, we had a bit of a moment.
In our imaging centre, the doctors want to show Paul exactly how the life-saving procedure was carried out.
I wonder if it would be helpful for you to actually see how the thrombectomy occurred, because we actually can show you that.
Okay, yeah, because actually I've got really quite vivid memories of it. So this is going to be really interesting to see it from a different perspective.
Okay.
They were describing the success rate. I think again from recollection, it was sort of, you've got a 3% chance of death or 97% chance. I'll take the 97% bit of it.
You were really, really worried, and I was like,
worried
it'll be
about
fine.
What, the procedure?
Yeah, going in and not coming back out again and that kind of stuff, yeah.
What Yogesh actually did was that he was able to help your brain up here, but he actually accessed it from down in your leg, didn't he?
Yeah, my groin, yeah.
Yeah, exactly.
With Paul still awake, Dr. Joshi guided a thin tube called a catheter through this network of blood vessels to get to the blockage in his brain.
What we're doing is snaking that catheter up to try to get exactly to where the level of the blockage is.
OK, freaky.
Coming further up, you can see from this side, I think you can see there's a hairpin bend that the catheter has to do.
Yeah.
So that doesn't always happen, so we have to negotiate that gently.
So is that where my ear is, about there?
So your ear's probably about out here.
Okay. Because there was absolutely no sensation to this until the point where I felt something go up past my ear.
Once the catheter was in place, a wire was fed through with a little grabber to remove the clot and restore the blood flow. Dr. Joshi has brought in the gadget he used.
What we do is we take this catheter and we put it through the clot.
Okay.
And then what we do is the device is then unsheathed.
Right.
And so it holds onto the clot.
Okay.
And that, I'll just pop the device out to show you. So if you keep an eye on that.
Can you see it there?
Do you see that? That's starting to open up.
Yeah.
And that basically holds onto the clot.
Yeah.
Then what we do is we pull that back.
Yeah.
Now the clot's already stuck a little bit to the vessel. And so as we pull it back, it also pulls the vessel a little bit.
Yeah.
And that's the pain that you feel.
Yeah.
And if we just continually apply the force, and we can then pull out the clot.
That's tiny, but I mean, the skill involved in getting something that size through something that small is just, it's amazing. I kind of imagined it's like a little litter picker thing that it
grabs it and pulls it away.
What I remember is four quite short, intense periods of pain in my head when I thought, obviously, you were going for that clot. And it was the last one of those, got really quite painful, that last attempt.
I mean, the only way we can get into it is by using these thin devices, and obviously even these sometimes to us seem to feel a bit aggressive, because as we pull this, you feel pain, and these brain blood vessels are not used to any movement, you know.
After the thrombectomy, my mobility was pretty good. It was fine. So physically, there weren't really many concerns, which is why I was able to go home the next day. It's amazing, isn't it? Absolutely mind-boggling.
Every 5 minutes, someone in the UK will suffer a stroke. But thanks to medical advances, mortality rates have shown significant decline over the last 30 years. And there are 1.3 million stroke survivors in the UK today. Although the thrombectomy saved Paul's life, he does still experience some neurological symptoms.
One of the main challenges post-stroke is neurofatigue. Can't describe it any better than it. You know, it's your brain just can't absorb anymore. I felt my brain just go, right, you've had enough there, Paul, because it literally throbs at the back of my head.
I have a little bit of experience of this with my husband being sick. When something is neurological, it's not just caring for a physical problem, is it? It affects the relationship as well.
It changes it, doesn't it? And you don't know how it's going to change, and being the non-affected person as it was, because you're still the same.
Yeah.
And they might not know how different they might be.
Yeah. There's a loss, I think. There's a loss for them in the fact that they're changed in some way, but there's a loss in that you have to adjust to as well as a partner.
Yeah, absolutely. Yeah.
You've seen a lot today. What are you thinking? What are you feeling?
It's a voyage of exploration, isn't it, about yourself? And you know, you look in a textbook and you see a generic skeleton or whatever, but actually to see you and what happened to you in brought to life in front of your eyes, you know, you'd never get that opportunity. I mean, it's amazing.
A low-fat, high-fibre diet, regular exercise, avoiding smoking and too much alcohol are all the best ways to prevent a stroke. But as for Paul, there's good news for the future. It's likely he will continue to improve. Even years after a stroke, the brain can repair itself by forming new connections to healthy tissue.
How was my brain?
Sorted, I think.
Yeah.
What was it like for you, Dr. Joshi, to be able to show Paul that procedure?
But to have Paul here and to kind of explain and sort of relive the procedure, It's something quite special.
I can see in your eyes that you feel like
Yeah.
something's changed. Have you got what you hoped for, a sense of the what and a bit of peace?
Certainly gives me the confidence that actually I think I'm pretty far along my recovery journey. I couldn't have hoped for a better outcome out of a situation that could have ended in a very different place. And now it's a case of, you know, continuing to enjoy family life. And
appreciating it, everything.
Relishing every moment.
Yeah.
And also maybe having more confidence to go forward, because I know you've got a big swimming challenge.
Outside swim.
Yeah, so I've got a challenge coming up that won't get me back to the levels of the Great East Swim, but it'll be a stepping stone. But actually, I think even getting back to where I was will be a fantastic achievement.
If you come over here, Dan, you can see.
3 days ago, Janet came face to face with her colon cancer.
Doesn't need a ribbon on it, does it?
Today, she's at Colchester Hospital for life-saving surgery to remove the tumour.
Seeing a beast in there, it's something you sort of think, well, it's going to come out, and it's going to come out today. I'm a little bit nervous now, but I'm looking forward to a good sleep.
In the theatre, a robot like this will be used to perform keyhole surgery to remove the cancerous section of Janet's colon. It'll be operated from a console by Janet's colorectal consultant surgeon, Mr. Vasudevan.
With the robot, you get a much better 3D vision inside, and you have the wristed instruments of the robot, which make the operation a lot more precise and easy. Okay, I'm just going to start moving things. So this is the inside view. So what we see right on the top there is the liver, and what we see here is the stomach. And this is the junction of the small and the large intestine, where you can see here. So the tumor is here.
Just as Janet saw in our imaging centre, Mr. Vasudevan will be removing a foot of her colon and reconnecting the remainder to her small intestine using staples.
So I'm going to start our dissection now.
First, Mr. Vasudevan is isolating and severing the blood supply of the section he plans to remove.
This is the blood supply to the right colon. Okay, I think we're ready for the clips. So I'm just going to cut the vein first. So scissors, please.
Mr. Vasudevan cuts the vein and then the artery supplying the section of large bowel.
That's it.
Before moving on to do the same to the small intestine.
So the blood supply is all separated. The colon's completely free everywhere.
Mr. Vasudevan uses a green fluorescent dye to distinguish between the section of Janet's bowel with the cancer, which now has no blood supply, and the rest of the healthy colon, which has a full supply of blood.
It beautifully lights up. So the colon has lost its blood supply for that bit. You can see where I'm going to divide it. It's got very good blood supply. Similarly, the small bowel that I want to divide is here. You can see that it's got really good blood supply. So we'll divide the small bowel here, divide the colon there, and then create the joint. Okay, let's have the stapler, please. Thanks.
Using a combined blade and stapler, Mr. Vasudevan severs the bowel at 2 key points.
So the colon is completely detached along with the tumor. So let's have a look at the cut end of the small bowel here.
Mr. Vasudevan then gently pulls the cut end of Janet's small bowel and joins it to her colon.
So I'm making a hole in the colon first, to get a stapling device in.
He then stitches the 2 ends together.
If I line it up nicely, hopefully all I need to do is slide it over this.
And staples them.
So I'm just closing the hole that I made for the stapler. Okay, I'm just going to take one more bite.
With the colon now rejoined, the cancerous section of the bowel is removed.
There's half the momentum, along with the blood supply and everything. Let's come out through that. Cool.
This section will be sent to a lab and checked. If the cancer has spread to her lymph glands, Janet will need a course of chemotherapy. She will find out her results in a few weeks' time.
Let's just close this quickly, and then we can close this, and then we're done.
It's been 2 months since Paul visited our imaging centre.
Hello.
Hello.
Nice to see you again.
Oh, it's so lovely to see you again. How are you feeling?
I'm feeling good, thanks, yeah.
Right. Well, you look fantastic.
Now accompanied by Dr. Goody, he's back to see his neuroradiologist, Dr. Yogesh Joshi. At just 44, Paul wants to know why he had a stroke so young and whether it could occur again.
Okay, come with me.
Okay.
All right, let's go. Hello.
Hi, how are you?
Good, thanks. How are you?
Hi, Paul. Good to see you. Please, have a seat.
Thank you.
And Paul, really, how are you?
Yeah, I'm doing really well, thank you. Yes, a few months now, ongoing recovery, so it'd be really great to chat a few things through with you.
Paul is really young, actually, to have had a stroke. Were there any risk factors in him that would have explained this?
Every time someone has a stroke, we do what's called secondary prevention. Secondary prevention is trying to prevent you have another stroke. And so you had a whole battery of tests. So we looked at your blood, we looked at your heart, we looked at your vessels, and nothing really has come out that's saying, oh, this is the cause of your stroke. So in that situation, you're down to living a healthy lifestyle, not smoking, having a good diet.
Are there any other things that Paul should be thinking about moving forward?
So in terms of what can you do with someone who's had a stroke, so we were looking at things like if your cholesterol was high, you should take a tablet like a statin to reduce your cholesterol. And your blood needs to be thinned slightly to stop it from clotting. So aspirin is a drug that we can then give to reduce the stickiness of your blood, as it were.
I'm healthy, and actually, if I manage myself, there is hopefully not much increased risk compared to a normal person of my sort of age and lifestyle. I've just got to come to terms with living with that uncertainty and being comfortable that there might not, well, that there isn't really a full set of answers. It's now a case of sort of trying to live with what I've got really and make the best out of that. So actually I can move forward with confidence about future risk really, but that's all thanks to the great procedure that I had.
Although Paul is young, the average age to have a stroke in the UK has been falling. 1/3 of all strokes now happen to people aged between 40 and 68. It's now been 3 months since Paul was at our imaging centre.
I've been really good over the last couple of months since the virtual consultation, but at least now I've got clarity on how lucky I was, and to actually see inside my head was an experience not to forget.
He's on his way to a 1 kilometre swimming event, the first since his stroke 2 years ago.
It's not going to be a Michael Phelps style swim. I think for me it's more about getting round.
Although Paul swam at the pool, this will be his first time in open water.
Hello.
Like a band, please.
Yes, there you go.
Thank you.
After a chilly circuit around the 1 kilometre course, Paul successfully completes the swim.
Thank you.
Well done.
Cheers, thanks a lot. Nice. Thank you.
Back on dry land, he has a chance to reflect on his journey.
It was tough out there, actually. I had doubts that I'd be able to do a competitive event again. Today was all about getting round, not making a fool out of myself, and you know, at the end of the day, I've survived. Getting that confidence back is fantastic. Lots of positives to take from what was a life-changing experience. It could have been a life-ending experience. So, you know, onwards and upwards.
It's been 3 weeks since Janet had the operation to remove a 4-centimetre tumour in her colon. The tumour may be gone, but the concerns are still there.
Today, I need to ask Subhash about test results, what stage I'm at, if the cancer has spread.
We need to know that it hasn't spread, and then we can take it from there, basically.
Oh, hello!
Along with Dr. Goody, she's back to see colorectal consultant surgeon Dr. Subhash Vasudevan.
So lovely to meet you both.
Thank you.
Do you want to come with me?
Yes,
All right,
thank
then.
you. Thank you.
Hello.
Hi there.
So, Janet, how are you feeling?
Very well. I do have a bit of a problem where I have to hold my tummy sometimes. When I first get out of the chair, it can be very uncomfortable. But no, I'm very pleased with how I'm going. I really am.
The muscle and things it takes a bit of time. It might take a few weeks for it to get better. You still got lots of colon left.
Yeah.
But it will adapt. I'm happy to say that you've taken everything out. Yeah. Okay, so there is no evidence of cancer left inside that you can see with the naked eye.
So I haven't got to have any further treatment, like chemo or anything like that?
There's no aggressive features in the tumour itself, so you don't need any chemotherapy, and I'm sure you're very pleased with that.
Oh, I am. Yes, thank you.
In fact, all 43 of Janet's lymph glands were negative for cancerous cells, which means the disease has been halted in its tracks.
So what we do from now on is to have a close follow-up for you, seeing you on a regular basis. So I think, you know, it's good news that we don't have to do anything further. We'll keep a very close follow-up, and then whatever needs doing at whatever stage, we can do it.
And Tom, how are you feeling about it all now?
Well, that's a wonderful Christmas present, isn't it?
Oh.
I said to him, what do you want for Christmas? He said, nothing, I've got you.
Oh. Isn't that the nicest thing you could be said?
To get the news that the cancer hasn't spread is, well, I'm elated. I couldn't ask for any better news. We can start planning to do what we want to do now. So that's brilliant news.
Oh, I've been very lucky.
Yeah.
Thank you. I've been very lucky. Yeah.
You can't thank you enough.
Yeah, we can't thank you enough. Good news all round, isn't it?
Oh, it's brilliant. Wonderful.
Yeah. Yeah. Today has been wonderful. Absolutely marvellous, yeah. The weight has been lifted, although I didn't realise I got all the weight on me. But to see Tom's face, you know, it's all clear, you know. I feel wonderful. I want to say a big, big thank you to Subhash. He really has sorted me out. He and his team have been absolutely perfect.
The success stories are always the nicest part, and you can give someone hope. They've had a cancer, but you know the chances are that she's had such a good outcome from this. She doesn't need any further treatment, and it's a big relief that I could see on their faces.